from the station that's working for you. You're watching Fox 4 News at 8 a.m.
Varicose and spider veins. Oh my. Not just unsightly, they can be very painful. They affect about 30% of the U.S. population. About 1 out of every 3 persons has some of those. Local doctor is going to be here with some reasons why people get them and how you can prevent them from progressing.
20 now, men and women both can be affected by painful varicose veins and spider veins, but there are lots of new ways to treat them. They don't have to be painful, and you can even prevent them from recurring. Dr. Craig Schwartz is here from the Vein Centers for Excellence with some new information. Some doctors don't even know about the new treatments you have out there.
Absolutely, very true. There's a lot of misinformation out there with the general public and even with the medical community as to the difference between what are varicose veins and what are spider veins and how we go about treating them today.
The old vein stripping that they talked about, that's not the option anymore?
Not at all. Old-fashioned procedure, painful, brutal, traumatic. Honestly, it hasn't been standard of care for going on 15 years now.
So varicose veins are the larger bulging veins that you'll see under the skin?
Absolutely. By definition, a varicose vein is a vein that is bulging out or dilated, whereas spider veins are the little fine, red, bluish, purplish, little tiny linear veins.
Okay.
Now, most people kind of lump those two things together, but the reality is they are completely different animals. Spider veins are really just a cosmetic issue. They don't lead to long-term problems, so they're not considered medically necessary, and unfortunately, almost no insurance company covers treatment for spider veins.
Okay.
But varicose veins, because they're due to a more significant underlying problem, really are considered medically necessary, and almost all insurance companies will provide coverage for varicose veins.
So what are some of the standard treatments now?
Well, everything that we do is minimally invasive. If you're dealing with spider veins, which again are just a cosmetic issue, there's a combination of both superficial laser and what we call injection sclerotherapy. Those two treatments work very, very well together, and honestly, in today's day and age, I think they're both mandatory. Now, for somebody who has varicose veins, which are again caused by a more significant underlying problem, we've got to do two things. We've got to deal with that underlying vein that's causing the backwards flow, or what we refer to as reflux in the vein, and then we've got to deal with the superficial bulging veins on the surface. The way that we do that is called laser closure or laser ablation. It's a very minimally invasive procedure. It's done right in the office setting. It's done under local anesthetic, so there's very little downtime to it. It's a very easy, safe procedure. And then we can deal with the bulging varicose veins on the surface by either a combination of injection sclerotherapy, similar but a little bit more involved than what we did for spider veins, or by doing what's called a micro-incisional resection or phlebectomy, where we create little tiny needle stick incisions and just take those bulging veins out so they're gone.
Okay. So if I'm a patient, if I have varicose veins, what are some things I can do to help minimize or prevent it?
Well, the sad truth is there's nothing you can really do to prevent them, because the main causes, number 1 is family history or genetics, number 2 is pregnancy, really are things you can't do anything about. However, there are some things that we can do to try to minimize or reduce or diminish the progression. And those things we call conservative treatment, the main areas of which are compression, elevation, and exercise. By compression, we mean using a daily application of a compression stocking. By elevation, we mean getting your legs elevated so that the blood and fluid in the legs can drain and decompress. Okay. And when I say elevation, I don't mean putting your foot on a footstool or up on the coffee table. With elevation, one needs to be reclined with the leg up above the level of the heart to allow that fluid to sort of decompress. Exercise is really good for the legs and the veins because when your muscles are working, they're helping pump that blood through the legs. What is bad for your legs is anytime your legs are going to be dependent for a prolonged period, either standing or sitting. So anybody who's in an occupation or activity where they stand or sit for long periods of time should absolutely be doing those 3 things.
Thanks, Dr. Schwartz.
My pleasure.
The Vein Centers for Excellence is located in Leawood. If you'd like some more information or have any questions, just give them a call, 913-451-8346.